Morning, boys and girls. So I'll be taking prescription part 2 for you. Part 1 was taken by Dr. J. Babu. So before going to the details of the prescription, we'll just brush through about a typical prescription. How does it look? What are the components of a typical prescription? Right. Suppose a question is asked for you. Prescribe for a case of hypertension. So you're supposed to write all the parts, basic ingredients which are necessary for a typical prescription. So a typical prescription consists of a superscription, inscription, subscription, and transcription. So before the superscription, inscription, subscription, transcription, so the question was asked, prescribe for a case of hypertension. So on the left top, you're supposed to write name of the patient with address, and then age, gender, address, and then on the right top, you're supposed to write doctor's qualification, that is your hall ticket number, address and contact number. And then superscription, it's nothing but treatment, RX, it's nothing but, it means take though, it is an offering to Jupiter, the god of Greece, a Greek god, an offering given to the god of Jupiter. That is superscription, RX it means. And then inscription. So you're supposed to write the body inscription means. That is, you're supposed to write what are the tablets you're going to write to the patient. So the question asked for us was prescribed for a case of hypertension. So here, so what are the hypertensive drugs? What are the suitable drugs which can be given to that patient? So you need to write tablets for the patient. That is inscription. That is, so the patient is hypertensive. So we are writing him atenolol tablet, atenolol 50 mg OD, 30 tablets. And then subscription, that is refill up to 2 months. It's nothing but giving direction to the pharmacist how to dispense the drug. That is subscription. And transcription. So it is giving direction to the patient when and how he should use it. So transcription, single tablet once a day, 8 a.m. after breakfast daily, and review after 3 months. So typical prescription consists of superscription, that is RX, it means take though, an offering to Greek god Jupiter, and then inscription, that is you're supposed to write the tablets, and then subscription, so it is giving the direction to the pharmacist how to advise, how to give the drugs to the patient and what to tell to the patient, and then transcription, it is giving direction to the patient how and when to take the tablets, and on the right side down, doctor's initial with stamp. So a typical prescription consists of, on the left top, the address of the patient, age, sex, gender, on the right top, doctor qualification, address, contact number, and the contents of a typical prescription are superscription, inscription, subscription, transcription. So whenever they ask you an exam, you are supposed to tell all these: superscription, inscription, subscription, and transcription. Superscription, RX, take to an offering to Greek god Jupiter. He is none other than god of healing. And then inscription, that is the body. We're supposed to write the tablets. And subscription, giving direction to the pharmacist how to dispense the drug. And transcription, so giving direction to the patient how and when he's supposed to use. And then write down, right side down, down right, doctor signature with stamp. So these are the contents of a typical prescription. Right. So now prescribe drugs for a case of urinary tract infection due to pseudomonas aeuriginosa. So answer is injection Piperacillin 2 gram IV once a day for 1 week, plus injection Tazobactam 250 mg IV. So take down prescribed drugs for a case of urinary tract infection due to pseudomonas aeuriginosa. So injection Piperacillin 2 grams IV once a day for 1 week, plus injection Tazobactam 250 mg IV. Okay. 14th one. Prescribe drugs for a case of hepatic amoebiasis. So answer is tablet Metronidazole 800 mg TID for 10 days In case of severe cases, you're supposed to give injection metronidazole 1 gram slow IV infusion followed by 500 mg IV every 8 to 12 hours till oral therapy is instituted. So prescribed drugs for case of hepatic amoebiasis. So the drug of choice or the drug which is supposed to be used is tablet metronidazole 800 mg TID for 10 days. So tablet 800 mg to be given initially for 10 days if the patient is severe, and he is supposed to be given injection metronidazole slow IV with infusion followed by 500 mg every 8 to 12 hours till oral therapy is instituted. So this metronidazole has got metallic taste, and it is supposed to be advised, the patient is advised, Gayatri. So this tablet metronidazole has got metallic taste, and then should be given cautiously. It is not supposed to be given patients who have taken alcohol. So this is prescribed drugs for a case of hepatic amoebiasis. The answer is tablet metronidazole, initially 800 mg TID for 10 days. If the patient has severe hepatic amoebiasis, he is supposed to be put on metronidazole IV infusion followed by 500 mg IV every 8 to 12 hours till oral therapy is started. Apart from this, tablet chloroquine should also be given. So tablet chloroquine phosphate 600 mg days per day for 2 days followed by 150 mg base BD for 3 weeks. So metronidazole should be given, and then the patient should also be put on tablet chloroquine phosphate 600 mg base per day for 2 days followed by 150 mg base BD for 3 weeks. Okay. Prescribe drugs for a case of acute attack of uncomplicated falciparum malaria. Prescribe drugs for a case of acute attack of uncomplicated falciparum malaria. So answer is chloroquine sensitive uncomplicated falciparum malaria should be treated by, on the first day, tablet chloroquine 600 mg base initially followed by 300 mg after 6 hours. On the second and third day, tablet chloroquine 300 mg OD plus primacquine 45 mg single dose plus tablet paracetamol 500 mg TID for 5 days for controlling temperature. So chloroquine should be taken initially 2 tablets, that is 600 mg, 300 mg 2 tablets, that is tablet chloroquine 600 mg base initially followed by 300 mg after 6 hours. Then on the second day and third day, after 24 hours of taking 600 mg, you are supposed to give tablet chloroquine 300 mg OD. That is, on the first day, 600 mg. After 6 hours, you are supposed to give 300 mg. On the second day, that is, after 24 hours after taking chloroquine 600 mg, you are supposed to give 300 mg on the second day. And on the third day, on the same time, you are supposed to give 300 mg. Plus, you are supposed to put the patient on primacquine as well. That is, a single dose of primacquine plus paracetamol 500 mg or 650 mg to control temperature. And then, if the patient is chloroquine resistant uncomplicated falciparum malaria, the patient has to be started with tablet artesunate 100 mg BD for 3 days plus tablet sulfadoxine 1500 mg plus tablet pyrimethamine 750 mg single dose. It is has to be given to the patient. So if the patient is suffering with chloroquine resistant uncomplicated falciparum malaria, the patient has to be put on tablet artesunate 100 mg BD for 3 days. Apart from this, the patient should also be put on tablet sulfadoxine plus pyrimethamine. So sulfadoxine to be given in a dosage of 1500 mg and pyrimethamine 75 mg. So the question was, prescribe drugs for a case of acute attack of uncomplicated falciparum malaria. So if it is, the patient is suffering with chloroquine sensitive uncomplicated falciparum malaria, he or she should be put on initially 600 mg chloroquine, then followed by after 6 hours 300 mg, on the second day 300 mg, on the third day 300 mg to be given OD, plus primacquine 45 mg single dose should be given. So one should be very careful while administering this primaquine because it causes hemolysis because of the deficiency of G6PD. So you have to look out. Very rarely this causes once in 1,000 or 10,000 like that. But then also you're supposed to be very cautious and you should use this drug in these patients. You have to look out for the deficiency because since they cause hemolysis. And then tablet paracetamol should be kept to control the temperature. If the patient is suffering with chloroquine-resistant uncomplicated falciparum malaria, the patient should be put on artesunate 100 mg BD for 3 days. Apart from this, sulfadoxine and pyrimethamine should also be kept on. And then prescribe drugs for a case of acute bronchial asthma for a patient who is 30 years of age. So initially, the patient is suffering with acute bronchial asthma. So there is bronchial constriction. So what are you supposed to do to get him relieved from the bronchial constriction? So nebulize the patient. So put him on oxygen nebulization with salbutamol. And then injection aminophylline 250 mg at a rate of 5 mg per kg in the first 30 minutes. Then 0.5 to 1 mg per kg per hour for several hours. In 5% dextrose, IV infusion should be started. So the patient comes to a clinic, your clinic, with complaints of acute attack of bronchial asthma. So you nebulize the patient with salbutamol and then you put him on aminophylline 250 mg at a rate of 5 mg per kg initially in the first 30 minutes, followed by 0.5 to 1 mg per kg per hour for several hours in 5% dextrose IV infusion. Prescribed drugs. So one should be very careful with this aminophylline since it causes some complications. So that is the reason why you're supposed to put the patient on IV infusion. Prescribed drugs for a case of child with Ascariasis. So the child is infested with nematodes, that is Ascarias lumbricoides. So what are the drugs you're supposed to give to that child? So the basic drug which is supposed to be given in case of nematode infestations is Albendazole. So for patients who are more than 2 years of age, the dose is same as adult dose, that is Albendazole 4 mg single dose to be administered before retiring to bed. And then tablet Pyrantel palmate 10 milligrams per kg, total dose 7 mg orally in a single dose. And then tablet Piperazine citrate 7.5 milligrams per kg once a day for 2 days. So the patient comes to clinic with an infestation of Ascariasis. Then the drug of choice or the first line of management should be Albendazole 400 mg single dose. Apart from this, you are supposed to put on other tablets as well, like Pyrantel palmate in a dose of 10 milligrams per kg, total dose of 30 mg, 300 mg orally in a single dose. And then tablet Piperazine citrate 7.5 milligrams per kg once a day for 2 days. And apart from this, you need to put the patient on purgatives like milk of magnesia, 5 ml OD for 3 days. Because after the administration of these drugs, the Ascariasis tend to die off in the body and they can cause accumulation. They can cause, obstruction inside the body. So to get relief of the obstruction, you need to give milk of magnesia or a purgative which expels the Ascarias lumbricoides outside. And then apart from this, the patient should also be kept on syrup B complex 5 ml OD. Prescribed drugs for a case of amoebic dysentery in a 35 years aged patient. So take down. So initially the patient should be kept on Albendazole, then Pyrantel palmate, Piperazine. Apart from this, the patient should be given even a purgative to expel the dead worms, that is Ascarias lumbricoides, to be expelled out. So you're supposed to put the patient on purgative and then B complex should be initiated. Now prescribed dose for a case of amoebic dysentery in a 35 years aged patient. So tablet Orinidazole 500 mg BD for 5 to 7 days to be given. Or you can put the patient on Metronidazole also. That is the choice left to the clinician or physician is attending the patient. Now, prescribed drugs for a case of supraventricular tachycardia in a patient aged 50 years. So here the patient is suffering with supraventricular tachycardia of age 50 years. So what are the possible drugs you need to advise for this patient? So the drug of choice is injection adenosine 6 mg to 12 mg IV fast, followed by 10 to 15 ml of normal saline IV rapidly. So the patient should be kept on adenosine 6 mg, 12 mg IV fast, followed by 10 to 15 ml of normal saline IV rapidly. Prescribe drugs for a case of moderate hypertension in an asthmatic patient aged 45 years old. The patient is suffering with asthma. Moderate hypertension in an asthmatic patient has got moderate hypertension as well as an asthmatic patient. So what are the drugs you're supposed to put the patient on? So tablet metoprolol 50 mg should be started or should be kept on. Prescribe drugs for a case of pulmonary tuberculosis in a patient aged 36 years old. So more than 50 kgs. So the patient is 36 years and he has a weight of more than 50 kgs or should be more than 50 kgs or he is more than 50 kgs. So what are the drugs he is supposed to be kept on? So capsule Rifampicin 600 mg single dose in the morning on empty stomach for 6 months. So initially the patient should be kept on Rifampicin 600 mg on empty stomach single dose for 6 months, and then tablet isoniazid 300 mg orally for 6 months daily, tablet pyrazinamide 1500 mg for first 2 months, and then tablet ethambutol 1600 mg OD for first 2 months. So these are the drugs which are supposed to be given. These are all the frontline drugs which are supposed to be given for a patient of tuberculosis. So the drugs like capsule rifampicin on empty stomach should be given 600 mg OD for single dose or OD for 6 months, and then pyrazinamide should be instituted, and then isoniazid. Apart from this, ethambutol. Prescribed drugs for case of grand mal epilepsy. So what are the drugs to be prescribed for patients suffering with grand mal epilepsy? Tablet is tablet phenytoin, sodium, and MGPD. Prescribed drugs for a case of acute attack of malaria due to Plasmodium vivax in a patient aged 35 years. So the patient is suffering with Plasmodium vivax, and what are the drugs to be advised? So initially on the first day, tablet chloroquine 600 mg base, followed by 300 mg after 6 hours. And in the second and third day, tablet chloroquine 300 mg OD, plus tablet primectin 15 mg OD for 14 days, and then paracetamol for 5 days. So on the first day, tablet chloroquine 600 mg base, followed by 300 mg after 6 hours. The first day, tablet chloroquine 600 mg base, initially followed by 300 mg after 6 hours. Second and third day, tablet chloroquine 300 mg OD, tablet primectin 15 mg OD for 14 days, tablet paracetamol 500 mg KD for 5 days. Prescribed drugs for a case of acid peptic disease in a male patient aged 40 years. So the answer is pantoprazole. So apart from this, we have other drugs like omeprazole, lansoprazole, and then rabiprazole. So whatever the clinician feels better, he can write. And the answer is any drug can be kept. So the answer is pantoprazole 40 mg OD for 30 days in the morning before breakfast. So that's it. So before concluding the class, I would like to stress upon, or I would like to brush through once again what are the parts of a typical prescription. So it has on the left side, right, left, you're supposed to write the name of the patient with address, name, age, gender, address. On the right top, you're supposed to write doctor, qualification, registration number, that is your hall ticket number, and then your contact number. So the typical prescription consists of 4 parts. That is superscription, nothing but treatment, RX. So it is nothing but, it means take though, it is an offering to Greek god Jupiter, who is god of healing, and then inscription. So it is nothing but body, wherein you are supposed to write the tablets. That is inscription. The subscription, it is giving advice or direction to the pharmacist how to dispense a drug. And then transcription, single tablet once a day at 8 a.m. or single tablet or whatever. It's nothing but giving direction to the patient how and when you're supposed to use. On the right down, you're supposed to write, there should be doctor initial with stamp. So these are the parts of a typical prescription, that is superscription, inscription, subscription, transcription. Make a note of this. If at all they ask you in exam or in Viva course, you're supposed to tell all this. So these are the parts of a typical prescription. Right? I hope you got it. Thank you.